started Soft Power Health after visiting Uganda, and I was here on a kayaking trip, and two of the guys on the trip got malaria, and then subsequently I became really interested as to what the local people did about malaria. I wanted to know, did they have it all the time? Did they have mosquito nets? What did they know about it? And initially nobody could tell me what the problem was, or what nobody knew. So I just did some research on my own with Jessica Mugerwa, who still works for me today. That's how the malaria program started, and everything evolved from there. Soft Power Health here in Uganda started out first and foremost as a malaria education and prevention program. Subsequently, we built a rural clinic, which opened in January of 2006, that provides primary and preventative health care. And the third program which we've started is the family planning outreach. Here in Uganda, malaria is the most common reason people visit a health center for any reason. And it is the most common reason people are buying medicine, is to treat malaria. Approximately 3 million children die each year from malaria. The world's burden of malaria is in sub-Saharan Africa, so that means 90% of the cases are here in sub-Saharan Africa. Worldwide, every year, probably 500 million people are infected with malaria. The only way you can get malaria is when Mrs. Anopheles bites you. And we know that Mrs. Anopheles bites you at nighttime. We also know that if you sleep under an insecticide-treated mosquito net, you can reduce your chances of getting malaria by up to 90%. So what that means here in Uganda is you can help save the lives of children under 5 and pregnant women simply by having them sleep under an insecticide-treated mosquito net.
When you teach them, it makes a big difference or an impact. Somebody, after seeing that signs of the malaria, then somebody will know, really I need a mosquito net. I think I need a mosquito net. So we have a slogan which says that knowledge is power. People need knowledge.
We sell each mosquito net for 3,000 shillings a net. That's approximately $1.40, $1.50 a net. This is a substantial savings for most people, because if they tried to buy the net in the market or at the pharmacy, they'd be paying, upwards of like $8 or $10 for a net, which they absolutely cannot afford. We did research before we started selling the nets to figure out what people would be able and willing to pay. And we landed at $3,000, and we've kept the price at $3,000 since we started. And it's worked, because people are anxious and willing to buy the nets. We have sold over 30,000 mosquito nets to people who need them. Sanduka Balunji.
Sometimes people ask that, won't we get any problems from the insecticide, any effects? They were scared, but after, when you teach them, they're encouraged, they go home and hang their mosquito nets.
We want people to pay for the nets because we want people to have some investment in what they're doing. From our follow-ups, from visiting people at home, we can see that when people have to pay a little something for the nets, they take better care of it, they use it properly, they pay attention to all the education that's been given, and they will actually share that information with people as well. And so it makes sense to have people pay a little something for the mosquito nets. I feel like Soft Power Health has had a very positive impact on the community here because we have a cooperative relationship with the community. We provide services, but we're not giving things away. You have to meet us in the middle. You definitely see things that are tough and they're hard to take and they're hard to deal with, and it moves your heart. But it's also a good reminder, to remember to be grateful for everything.